Hi everyone, I'm Frances, I'm a dental hygienist. I'm quite different to a lot of other people that you come into contact with because I'm way later down the line. So I literally just work in a very normal dental practice, but it's the people that come through the door and share their story with me that inspire me to carry on doing what I'm doing, and to learn more about what I can do to support my patients way later down the line, often when they're in the effects that Emma has just talked about, those late stages. Next slide. So as we talked about, a lot of those are obviously in your mouth. So, sorry, Jane. So a lot of those are in your mouth, which means that they're going to affect your oral health and also affect dental professionals that might be working with you later down the line as well. So there's a lot of communication that needs to happen with us as well, and I'll talk a little bit about that later. But the big things, obviously we're thinking fibrosis, swallowing issues, definitely a big thing if you're having any dental treatment done. Saliva changes, and we've heard a lot about dry mouth being a huge issue here. Trismus as well, so that opening, if you need dental treatment done and you have very limited opening, that's obviously really challenging. Spasms as well, so being aware of how that might affect you when you're in the chair or at other times. Hearing damage as well, if you've got hearing loss or tinnitus, how that might affect you when you're being treated as well. And then obviously swellings about the head and neck as well. So I'm just going to kind of feel like a lot of that's been covered already, so I'm going to go into more about mouth care specifically. So next slide. So as we said, a lot of those things contribute to tooth decay, to gingivitis and to gum disease, and can also contribute to bad breath as well, so halitosis. So it might be that you've got dentures, you've got obturators, you've got other prostheses in there that collect plaque, make it more difficult to clean round. If you've got trismus, it's harder to get in there with sufficient oral hygiene aids as well to be cleaning really efficiently. So you might find that you get a bit of localised gingivitis around clasps and around areas you find it more difficult to access. So gingivitis is just the precondition to gum disease, and gingiva being the gums, the itis being the inflammation. So it just means inflammation and swelling of the gum tissue. And often what we see in head and neck cancer patients is that that can be quite localised to areas that you either find more difficult to get to with your oral hygiene routine, or that is around prosthesis as well. If that's then not addressed, it can then lead to gum disease, which is where that bacteria starts going down into the bone around the teeth. You're going to get things like mobility and recession around those areas. So it's really important, as everything always is, prevention is better than cure, so trying to limit it at its gingivitis stage to reduce that effect of the gum disease in those particular areas. Because we also know that then if there's tooth loss, if there's mobility, that's going to impact reconstruction, impact the fit of the prosthesis. You might have to go through all that kind of thing again. So it's really important to try and maintain those things. Next slide. Wonderful. So yeah, I think we all agree, the three of us agreed earlier, there is no one, silver bullet that's going to help everybody exactly the same. And it can be a case of just experimenting. Some things might be good for you, other things just a waste of money and a waste of time. So I think it's really important not to be product led, and not to be we all like to be impartial, I think. Not to be suggesting something that's completely unsustainable. Often things are very expensive as well. It can be quite a big barrier. So I think a lot of lifestyle changes, like really regular hydration. I would also, I'm being really boring now, but a plea is that it's plain water or plain milk in between meals. I'm not saying, don't drink the fun stuff at certain times of the day. But if you're going to really safeguard your oral health, it's the bits in between your meals that really affects your teeth the most. And that unfortunately does include sparkling water. Sorry, I know people feel very strongly about sparkling water, but it is quite acidic. So I do try to advocate for that to be consumed at the same time as meals. Every time you eat something acidic or eat something sugary, it causes what's known as an acid attack in your mouth, and that's then when the potential for tooth decay is more. The teeth start softening during that time. So if you can have safe snacks and safe drinks in between your meals, you're going to be keeping your teeth nice and strong throughout the day. So there might be things that you can do to help relieve. Some people like moisturisers, bog standard Vaseline, lip balm, that kind of thing. There is some other sprays, and I loved your olive oil tip earlier. I think that was, yeah, something I'm learning so much today already. But yeah, I mean, that's cheap. It's easy to get hold of. Coconut oil, again, it tastes nicer than olive oil potentially as well. Mouthwashes can be really useful just if you're out and about. I don't particularly advocate for one over the other, as long as it's not got alcohol in. Alcohol, although it feels good at the time, it can dry out the mouth and can cause some stinging as well. So you want to find something that's got a very mild flavour. And things like biotin or Aleve can, again, it's an experimental, you know, you try something, buy a little bottle, see whether that helps, especially if you're at work, if you're speaking, if you're on the go, just that kind of mild relief in between your big brushes and your big sort of sort outs with your oral health. It's the best time to do it, because also mouthwash actually should be used at a different time to brushing, unless you've been specifically advised by your dental or health professional. It means that you're getting the full benefit of your toothpaste and whatever else you might be using at that time, and then your full benefit of your mouthwash at a separate time of day. There's only so much, often it's fluoride that we're really after. In toothpaste, there's only so much that your teeth can absorb at one point, so it's best to try and do your mouthwash at a different time, because you shouldn't be rinsing out with water, and I'll come on to that when we talk about toothpaste. And there's other things like chewing, sucking things that you can put on the side of your cheek, side of your mouth. Again, it's just an experiment to see what maybe works for you. We've got a couple of patients that swear by these dry mouth melts, and other people that say that they're useless. So again, it's just trial and error, I'm afraid. Next slide. So in terms of making changes, again, slightly boring, but diet changes. You need to safeguard your oral health, as we said, about knock-on consequences of poor oral health then on the rest of your sort of life after that, changing prosthesis, that kind of thing. So limiting those sugary drinks and foods in between meals is really going to do that. Low in acids, including citrus and sparkling drinks. So, sorry. Toothpaste is a really big topic. I'm a big advocate for fluoride toothpaste, personally, and the evidence shows that it's the best thing to re-strengthen your teeth. But we also find that a lot of toothpaste can be quite strong, and that's not always suitable for someone that has maybe more delicate soft tissues. So we want to find something that's maybe SLS free. Sodium lauryl sulfate is a foaming agent. It's found in shampoos and soaps and stuff, but it can often be quite irritating to the soft tissues. So maybe try and find one that is SLS free. Something like the Organise is a non-mint, very mild toothpaste. Even Sensodyne Pro Enamel doesn't have SLS in, and that's a lot more widely available. It tends to be a bit cheaper than a more specialised one. So it's just an ingredient to look out for. You might, though, have been prescribed Durafat by your dentist, by a medical professional, which is a high fluoride toothpaste if they think you're at particular risk. After we've brushed our teeth, we shouldn't be rinsing out with anything afterwards, including water. Most areas in the UK don't have fluoride in their water, so once we're rinsing out the toothpaste, we're just getting rid of all the good stuff off our teeth. So spit out the excess. If you feel like you're having problems with swallowing, make sure you're leaning over so it's less likely to aspirate back. But we should, just be spitting out the excess toothpaste and leaving the rest on the teeth. That's the best way of getting the full benefit, especially overnight. You can rub in something like, if you've got sensitivity, you can rub in the toothpaste back to those sensitive areas to kind of use it like topically, like a cream. Next slide. Lovely. So I'm actually slightly show and tell at the moment. So yeah, we've got toothbrushes. Obviously, that's going to be your main source of cleaning your teeth and your mouth. Electric toothbrushes, they do remove more plaque. If we look at the evidence, they are better at plaque removal, but they're often quite bulky. Often those vibrations can be quite irritating. It's difficult to get everywhere. So often people will use an electric toothbrush, but then they'll maybe use something different as well. To kind of get in all the areas that they can't get to. Other people, manual is fine. Again, it's a bit of a personal preference unless you've been directed by someone you're working with on an individual basis. No matter how good your electric toothbrush or your manual toothbrushing is, it still doesn't get in between the teeth. If we miss out on our flossing or our interdental cleaning, we still miss 40% of the tooth surface above the gum line. So think all the teeth are like rectangles, and the brushing only does the long sides. We've also got to do those short sides as well. So we've got things like your normal bog standard floss that you're wrapping around your fingers and trying to get in. If you've got limited opening, that's going to be really, really difficult. So appreciate that there's other things that are probably better than normal floss. So stuff like your interdental brushes, your TPs, that's the biggest brand of them, although other brands are available. You've got ones though that are on a right angle as well, which not many people have seen. So yeah, something that's on a nice long handle is going to allow you to get right to the back of the mouth. So yeah, these are your standard TPs, but literally just on that angled handle. So you slide it down the inside of your cheek, and then it's already at the correct angle to go through in between your teeth. And it's good to be guided by a dental professional on the size you might need as well, because there's literally the pink one is super, super narrow, and it actually goes up to a black, which is about that fat, and that's more for gaps in between the teeth. There's other things that I think this is probably my most favourite thing, is a single tufted brush. I just bought these because it's easier to explain rather than explain if you've got it with you. But it's a tiny toothbrush on the end of a really long handle. And again, that's really useful if you've got limited opening, if you've got complicated prosthesis, if you've got recession around the teeth. Always recommend these to pretty much any of my patients. Wisdom teeth for teenagers, like literally anyone, I will recommend this. You can get them with a slightly longer bristle as well, but I do find that you can always wet it first, so it kind of slides down the side of your mouth, and then clean around specific areas. Something that's relatively new, like water flossers, can be really useful as well. So for your average person, I would rather than rely on mechanical cleaning with flossing and interdental brushes. But if you're struggling to get in places around implants, around reconstruction work, a water flosser can be really helpful. And there is actually a really great suction toothbrush for home use now as well. So if you're worried about swallowing, if you're worried about aspirating any sort of debris as you're cleaning, that can be really useful to use as well. And that can be used by a partner, by someone at home, if you're struggling to do it yourself. That brings us on to the next slide, which is about building your team. You might need someone to help you at home. You're not always going to be 100% on every day, and there's no shame in asking for someone to help brush your teeth, to help get in between the teeth, help floss or use interdental brushes. That's really, really important to maintain your oral health. I think I'm way down here, like I'm later down the line, and I personally wish that I could see any person that's gone through cancer treatment. I wish I could see them every 3 months, because we know that there's really debilitating effects in the oral cavity. But it's important to find someone that you trust as well. Back out in general practice, most of us don't see loads of head and neck cancer patients on a daily basis. So it can be difficult to find someone that you trust, someone that you want to work with. Stick with them when you do find them, but also when you're looking for someone, explain on the phone, give them a ring, say, can I come in and meet you for a chat first? Sit down and explain some issues if you're worried about spasms, if you're worried about opening, if you feel like your dry mouth is really debilitating, and actually for someone treating you that might be a bit of a barrier. Try to explain it to them. I think Emma mentioned it previously, that the biggest learning thing for us is you guys, and the more you can communicate with us, the better treatment we can help provide you. So hopefully that's given you just a couple of extra things in terms of your mouth care, but I'm here for any questions and to have any discussions as well about that.